Most common injuries that we get at physical therapy are low back pain. And a lot of it's not even injuries, it's just chronic pain. So when people come in dealing with chronic pain, we try to educate as much as possible, right? Because at the end of the day, that's what they lack, the education. They go and get an MRI done and the doctors tell them, oh, you got a degenerative disc disease or you have a herniated disc. And don't really go in depth explaining to them that it's not that bad, that it sounds a lot worse than it actually is. So what we try to do here is educate. So here's the vertebrae, right? Pelvis, the sacrum, the lumbar. And here's what a bulging disc looks like when it's exaggerated, right? But majority of people bulging disc are not that bad. So when they say that you have stenosis of the vertebrae, what they mean is that the bulging disc is getting in the way of that canal right there, that little hole, which this nerve root is coming out from. So when that occurs, that bulging disc is applying pressure there, and that's what's causing the numbness and tingling. So is there ways to get rid of this without surgery? Yes, there is. What we need to do, we need to be able to mobilize the vertebrae to be able to open up space a little bit, to be able to decompress that nerve and try to decrease that herniated disc. There has been research that's able to prove this. And also, objective, clinical studies, like here at my clinic, for example. I have had a lot of patients that come in that the doctors tell them, you're gonna need back surgery. That's the only way to be able to get rid of this pain. But in order to get back surgery, you have to go through physical therapy first. In order to get an MRI, you have to go through physical therapy first, right? So they come in with the mindset of just, this is one of the first steps I need to do to be able to get my surgery or get my MRI. They don't come in here thinking that they're gonna get better. So it's my job to educate and sell physical therapy, right? Not sell physical therapy as for me to get income, but for them to believe that physical therapy is gonna help. So what I do in depth, I explain what physical therapy is, what we specialize in, what our scope of practice means. Other clinical studies that I've had in my clinic of patients getting better with similar issues or even worse. Because I've had multiple patients come in from all backgrounds that they needed back surgery, and they come in and they're like, Francisco, ya no tengo dolor. I don't have no more pain, Francisco. But the surgeon is still pushing me to get surgery. He said, I still need to get it. They keep calling me. And I let them know this. Do you have a difficulty with function? Or do you have a difficulty walking? No. Getting out of bed? No. Going from a sitting to a standing position? No. Bending down to tie your shoes or pick up your keys or pick up groceries? No. From a 0 to 10 scale, what is your pain level now versus what it was before? And then they explained to me, like, it's a lot better. I don't even have no pain anymore some days. I don't have no numbness and tingling no more. So why is the surgeon still calling me to get surgery? I'm not going to answer that. But when surgeons do that, it's pretty simple to understand why they want to do it. But if they don't have no functional deficits, even though the image shows what it shows, we treat the patient, we don't treat the image. So that's what people need to understand. If you don't have functional deficits to the point where it's affecting your activities of daily living, there's no reason why you should go under the knife. Because at the end of the day, maintaining mobility, maintaining strength with proper interventions to be able to help you with your pain, with your discomfort, to be able to help you do your activities of daily living with minimal discomfort or none at all. And if all these are achieved, what is the point for going under the knife? So avoid those phone calls. Go see your local physical therapist, because you could get better. But you have to go in there with the mindset that I'm here to get better.